arthritis generally sets up in joints which are injured, with ligament injuries, fractures around the joints, deformities around the joints. So avoid injuries. The fourth component is genetic. There's a genetic tendency we will have in the family. It will run set of osteoarthritis in your joints.
People are pushed nowadays too much towards surgery.
We were compared to carpenters. My other medical. Your question is very important. When do you stop, and when do you go on?
Yeah, because in gym I've really seen that people, even if they're in pain, they will push. They take it as a challenge and they push it more.
In some cases, it really brings them back to 5 steps. So now they are stuck with the broken ligament or injured rotator cuff inside the shoulder, which will never heal. You should not take calcium because you want to make bones healthy. Bones will become healthy when you take a balanced diet, which includes natural calcium coming from the milk, egg, meat, whatever product. So it will mainly go into your bone when you are exercising. When you walk every day, if you don't do any workouts, your bones will generally not absorb as much calcium as they can.
Ladies and gentlemen, get ready to be inspired and enlightened by our esteemed guest on today's episode of Med Talks by Dr. Anita. We are honored to welcome the distinguished Dr. Kirti Mohan Marya, a name that resonates with the excellence in the field of orthopedics. Over 2 decades of unparalleled experience across Dubai, Mauritius, and India, Dr. Marya has mastered the art of orthopedic surgery. A true academic at heart, he has imparted knowledge as a lecturer and assistant professor in leading medical institutions like SSR Medical College in Mauritius, shaping the future of medicine. His extensive training spans across the globe, from the prestigious University of Bath in UK to Academic University College in Groningen in Netherlands and Singapore Aviation Academy, where he honed his skills in sports and exercise medicine, arthroscopic surgery, and aviation medicine. He also holds FIFA diploma in football medicine from Switzerland. Dr. Marya's expertise also extends to rheumatology, joint disorders, and osteoporosis management, making him a versatile and highly sought after specialist. His contributions to the medical field are further underscored by his 30-plus publications in international journals and his role on various editorial boards. Recently crowned as CMO of the Year 2023 by Health Awards UAE and Fortuna Global Excellence Award UAE. Please join me in giving a warm welcome to Dr. Kirti Mohan Marya, a luminary in the world of orthopedics, here to share his invaluable insights and expertise with us today. Welcome to Med Talks by Dr. Anita, Dr. Marya.
Thank you so much, Dr. Anita. Thank you for such a nice and warm introduction. Thank you so much.
Pleasure is all mine. I hope it's fine for you calling me Dr. Marya.
Absolutely fine.
It's quite a big name. So Dr. Kirti Mohan Marya. However,
no, it's absolutely fine.
Each word is like, it has its own unique,
Yes.
Importance. Can you just tell me what... so Kirti is basically a female name, if you don't mind me asking. The first time when I heard about your name, I was like, okay, maybe a female. You must be knowing what made your parents keep your name Kirti, and what does it mean?
Okay, so Kirti is Yash Gaurav, pride. I think there was a cricketer called Kirti Azad, those days. And probably they took the inspiration from that cricketer.
Okay.
And I think that was it. There was not much of a deep thought given into that. And then it's a unisex name. I have a few of other male members who have the same name as well. But I think the inspiration came from Kirti Azad that time.
Yes, true. And what made you choose orthopedic surgery? There is medicine is huge. There's so many areas of expertise you can have. But why orthopedics?
See, that time when you are just a graduate, having finished your MBBS, those days for us it was more of a competitive exam that you need to appear for postgraduate training. And based on your qualification and your marks, you get to choose a specialty. For me, the choice at that time was open because I had been in one of the top 10 rankers there.
Wow, top 10, huh?
So for my college, the choice was open between all specialties, including radiology. That time radiology was probably at its peak. Orthopedic was interesting because at that time, my idea was, it's one of those surgical branches where you can change or impact a patient's life on the same day as the surgery has been done. Somebody who has a fracture, you treated it with a plating or a nailing, and the patient is able to stand up the next day. So other procedures might take longer. Medical sides take months and years to control, for example, the sugar of a patient.
True.
But the quickest impact. So that time the mindset was,
immediate fix.
Immediate fix. You are going to do something for the patient at the same time. So the feeling that you get of making an important change in somebody's life so soon was probably one of the things in my mind at that time. And of course, things evolved later on, once you specialize and then you treat a lot of patients, then you understand what you should be doing, what you should not be doing. But I
Right.
think at that time, the impact was that immediate benefit you can give to a patient.
That's wonderful.
Yeah.
That's wonderful. So, what are the common cases you come across? Like, this is the maximum chunk of patients which come to me in your daily practice.
So orthopedics, since the time I did my post-graduation way back in 1999, has evolved a lot, right? That time, we were compared to carpenters. You know, my
Oh
other
my
medical
goodness.
colleagues would say, you guys are just carpenters. You are
Really?
fixing things, you know, just like a carpenter would with nails, screws, and plates. But since then, orthopedics has evolved into sports medicine, for example. There are super specializations for joint replacements, for spinal surgeries, for ligament injuries, and maybe even tendon transfers and all of that. Of late, if I see the kind of patients we see, it's a mix depending on the age group of the patients. With the younger age group coming with congenital issues, flat feet, those kind of bow legs and all of that. When you have an active age group of 20s and 30s, it is generally these days sports-related trauma. People have become more active, so there are more chances of injuries when you play sport when you're not prepared. And of course, in the elder group, it is all about osteoarthritis, joint problems, spinal problems, spondylitis, all those things. Besides serious issues where there are bone infections or bone tumors or other serious concerns, but mainly it is a mix of arthritis, if I can
Okay.
summarize it, and sport medicine or sport injuries, basically.
Okay. How you feel is, how much is the importance of having a second medical opinion from a doctor before going ahead for a surgery advised by any of the doctors?
Look, let's say that we compare this to buying stuff.
It's a tough question. I'm
I
sorry.
know, but I have a very simple answer for that. Let's say you're planning to buy something for your household.
Right.
What do you do normally? You just try to see what I like. How does it compare to other similar things? What are the outlets which sell those things? And then you compare prices or you compare the quality. Second opinions are nothing more than that. I mean, when you are going for a procedure which sounds little surprising to you, patients tend to take a second opinion. When somebody comes as some procedure is sounding or looking like something really big, which will impact your life, you tend to take a second opinion. So patients take second opinion generally to make sure that, are we completely informed? Sometimes they're unsure because there's a communication gap between the first doctor who treated them for anything. I mean, it's not only for my branch. Patients take second opinion even when they have hypertension these days. They are not sure about whether the medicine prescribed by the first doctor is the only option that I have, which is fine. I mean, I take this in a very positive manner because these days it's all about communication. Patients have awareness, they have knowledge, and why not? When they have everything out their hand,
Right.
through the impact of social media, through the impact of reviewing on a Google, they are at least, they have some set of knowledge which they can gain from even some authentic sources.
Right.
And when they come for a second opinion, the reasons are many. Most of the time in orthopedic practice, which is very quite surprising, one of the commonest reason for patient coming for a second opinion is because their pain has not gone. Right. It is as simple as I have been treated with it's minor problem with Dr. ABC, but I still have that problem or I still have that pain. Pain globally, I can give you a figure as well. I mean, it's a global scale. Pain is the number one factor for orthopedic patients seeking second opinions because the first doctor was either not able to identify the intensity of the patient's problem or was not able to offer appropriate remedy, either in terms of a good medication or a stronger medication or other options besides the medication.
Absolutely. So this itself says that the cause is not being properly detected and the treatment is not done well, right?
Insufficient, I might say.
I'm not questioning the entire medical fraternity, but it might happen that one doctor suggestions or the treatment can vary from the other doctor, and having opinions can really give you a right direction that okay, this is something has to be done, right, in order to get rid of that particular suffering.
Very true. So if somebody has come to a doctor for, let's say, a headache, right? A headache could be as simple as a headache because of dehydration. You didn't drink enough water today, versus a serious condition like a brain tumor. And imagine everything in between.
Right.
Now, a person who has seen the patient for the first time sees this as a common problem, but when the patient comes for a review and the problem is not resolved, either the doctor has to review his judgment or her judgment about what they're thinking the problem to be, or the patient will take a second opinion.
Absolutely.
Because they need solution to their problems. When the solution is not offered appropriately for whatever reason, they seek second opinions.
And that's a good thing to have. Absolutely.
That's a good thing to have, because sometimes there might be problems when the first doctor for some reason is not able. Everybody is human.
Absolutely.
You depend on a lot of factors. The way the story has been conveyed to me makes a very big difference to what I will be thinking about my primary judgment about a patient's condition, which is why it is very important for doctors to listen to the patients, which unfortunately in many cases doesn't happen. When you listen to somebody's story, you have to give them time. For the first time, I always sit back, hold my hands in front of the patient and tell them, I'm here to listen to you. 90% of my diagnosis is made at the first call based on the patient's history itself. It's very important to do that. The investigation part just allows me another 10% in usual patients.
Right. Nick, this dizziness in today's time, it's very hot outside. I mean, I'm talking about UAE weather. People sometimes confuse whether it's the dizziness is related to the heat, whether it's related to the cervical nerve decompression, or whether it's related to ear. So there are three causes which it can. There are multiple causes, in fact.
True.
But how can we differentiate between a dizziness which can be because of cervical, the neuropathy, radiculopathy, to be specific, or can be ear related? How can we differentiate?
So sometimes it is very difficult to differentiate. Most of the times it is pretty easy. So when we look at somebody's history of when the dizziness started and how, if it is an orthopedic cause, which is something to do with the cervical spine, it is related to something that the patient did with their posture. I had some interesting cases where they were fine and they suddenly went to get a massage done, and the massage was probably a little bit more harsh on the neck. Next day, the patient starts having a severe, dizziness
after
and
massage,
vertigo.
cervical pain. Okay.
Patient already had a pre-existing cervical spondylitis, which was underlying cause, but patient was not aware of that because till that time he didn't recognize that pain or discomfort. So vertigo, when it comes to the ENT causes, it usually follows a bout of a respiratory infection or ear block or something to do with URTI, and then they follow it up with vertigo. Orthopedic causes are usually related to the upper neck and shoulder stiffness and pain that has been going on, and suddenly they develop a vertigo after getting up from the bed or after having a sleep on a wrong pillow or something like that. So when it comes to physical histories, the prior history is more physical in nature when it comes to cervical issues, and it is more of a respiratory infections and cough, cold, flu, having a ear pain associated with dizziness, where we generally ask the patient to take an ENT opinion as well.
Okay, so that's how you differentiate between the two vertigos.
So the other part which you mentioned about dehydration or weather-related changes, or somebody is weak, anemic, the dizziness has hundreds of causes, but those are probably more easy detectable based on the patient's findings, clinical histories and all of that. But we generally get mixed up between patients who have ear-related issues versus orthopedic issues, which is more difficult, at some stage to identify when patient has very subtle symptoms. So the thing about medicine is, and you agree to me, is when nobody comes with a textbook picture, right? The more experience you have, the more you understand that you can't just go by the textbook, which is why it is important to hear the patient out. The information is hidden there, not in a patient who has actually a vertigo because of an inner ear infection can also co-present with a cervical spondylitis on an X-ray. But the X-ray is not going to tell me what exactly the problem is. What is causing the vertigo? The X-ray is showing what is there in the neck. I have to interpret based on that finding. Is it really because of that? And there are some tests that we can do, of course, to understand whether it is more of an ENT issue, vertigo, inner ear issue, versus the orthopedic issues as well. But yes, the important part is subtle symptoms are difficult to diagnose. Cases which come straight on your face with a very textbook picture is very easy to diagnose them.
Right. Even the radiology, the diagnostics also, they mention correlate clinically. What you're seeing in front of you, based on that, you should be able to justify, because sometimes even the reports might, say something different than what you're saying clinically.
Very true. So correlation is the key in a good healthcare practice. There's no doubt about that, because you can't just depend on a finding, either radiological or even, blood profiling.
Right.
You have to make judgment call based on so many other factors.
Right. Disc bulge, disc degeneration, disc issues, anything related to disc of the spine, does it really require surgery? Because people are pushed nowadays too much towards surgery. Any spine issue, go for surgery. Any spine issue, go for surgery. At what stage a person should decide, okay, this is the right time to go for a procedure? I should see a doctor for, to see the primary management if I can get rid of this rather than landing into a surgery. Because spine surgery is a major surgery. Is the trunk of your body.
True.
So what are those things which a patient or a person should consider before heading for a spine surgery?
Okay, so there are two kinds of disc issues I would grossly put it up. One is which are related to the age-related wear and tear, which is a part of the spondylitic changes and all of that. The other one, which is more common, is younger people having slip disc, which is the common word that we use, because they lifted something heavy or they pushed or pulled something heavy, which caused the physical impact on one of the discs of the lower back or the neck. And that can cause them symptoms, and sometimes they don't cause any symptoms. So it's not about the presence of a disc inside a MRI finding or an X-ray. It's just that a patient who has symptomatic disc problems, which might aggravate to such an extent that it might temporarily or permanently affects a patient's lifestyle or a limb. For example, by getting a limb, arm or a hand completely numb and reduce the power. It doesn't become paralyzed. A lot of people assume this problem can cause a paralysis. I've had some patients telling me that the doctor who was asking them for a surgery has told them, if you don't do this surgery, then you're going to get a paralysis. So that is a little bit extreme. Paralysis has something to do with the brain hemorrhage and other clots in the brain rather than disc issues. But yes, there can be a loss of power or a reduction in the power, I would say, causing a patient to walk inappropriately. Let's say with a limp, if you have a foot drop because of a nerve compression. So disc problems which are only giving pain in the back are generally easily treatable without surgery. Disc problems which are documented on an MRI with a large disc causing compression on the nerve, on which patients or the doctors have tried appropriate treatment for, let's say, a period of 4 to 6 months by giving them the right kind of medication, the right kind of lifestyle advice, the right kind of physiotherapy, the right kind of weight loss program. In spite of all these things, conservative treatments, if the patient has failed to improve, that means rather than letting the patient be on medication for lifetime, we rather remove the disc with a small keyhole surgery, which is available these days, and make them pain-free on the next day itself. So for the right patient, the surgery is a very, very helpful tool. But I would say 90% patients of spinal disc problems, they generally do good without surgery.
Wonderful. 90%, that's 90%. A big number.
Because we have a lot of patients nowadays who are diagnosed very early into disc problems. 20, 30 years ago when I was studying medicine, MRI was hardly available 30 years ago. It just had come in 1990 when I joined MBBS. So since that time, MRI has become so accessible that I don't see any patient nowadays who has not done an MRI till now for any reason, right? So, which means you have much more diagnosed conditions, but not serious conditions, which is why 90% patients do improve. Another interesting fact is patients who are not that serious kind. So we generally categorize patients who require surgery, spinal surgeries, as those whose bowel and bladder function has become affected. Okay. Those who have a nerve compression, which is causing them a muscle dysfunction, as I mentioned earlier, foot drop, for example, or a kind of a severe numbness in their toes or hands, which is not improving at all. So these are or some patients who have very, very large discs, which behaves like a sitting time bomb, which could go wrong anytime they travel, and then suddenly they need to go to the emergency department there and get operated. So very few conditions like these three, which I mentioned, are actual 100% indications to get the surgery done to remove the disc. But most of the patients don't fall into these categories. They fall into minor disc problems. They can be easily rectified with appropriate physiotherapy, with appropriate advices on lifestyle changes, the way we sit and work, the way we lie down and watch TV and all of those things.
It's important. So when a person can take a call, okay, now this time I should head to a physiotherapist before rather than going to an orthopedic doctor. Everybody wants to avoid doctors.
Hi. Doctors are good. They're good people.
Absolutely. You and me can agree on that, but not everyone,
Right.
So when can they take a call that, okay, now I think I should go to a physiotherapist rather than going to an orthopedic doctor? Any specific case, or they should always go to an orthopedic doctor and then the physiotherapist? Physiotherapist must be happy by hearing this question.
So I would really answer this question in all the seriousness, okay?
Right.
So physiotherapists are great people. They know if they put their hearts and minds and hands onto the right physical therapy for the patient, it can change the patient's lives.
True.
So technically, in Dubai, I can talk about UAE. Technically, in UAE, the patient is required to visit a doctor, preferably the orthopedic surgeon, to diagnose the condition appropriately and then find out what kind of physiotherapy. There are a lot of techniques of physiotherapy. What would the patient really require? And then we refer to the physiotherapist saying that, okay, look, I feel this patient doesn't require as much of my help than taking your help. So in case of insurance, for example, they generally need a doctor to examine the patient, make the appropriate investigation, and then refer the patient to the physiotherapist.
Right.
And a lot of patients get confused between doing a physiotherapy versus a massage, or doing versus something like a Pilates or some other kind of activity. Those are not therapies. Even a lot of patients nowadays are happy to go to a chiropractor
Right.
than visiting a doctor. Not because I'm a doctor, but I can tell you a bit of a history of why this happens. Chiropractors in the West, they started mainly in the US. Why? Because getting to see a specialist at a short appointment is quite impossible as we speak, even now in the US. So you can't really visit a specialist doctor in orthopedics as soon as that you want to. So if you have a minor back pain and you have a little bit of a stiffness because you drove a lot today, you don't really need to visit any doctor for that matter. So there are a lot of chiropractors available. They generally have a different belief in how to treat the conditions as compared to we from the medical side. But they do the job quite well and patients are quite happy about that. So when you have a minor issue, short-term issue, when you don't really have a serious thing going on for a long period of time, you might just get a simple massage done. You have all kinds of Ayurvedic massages as well available. Or you can go to a chiropractor to set, things that they do.
Right.
When your condition is something that has been going on for quite some time, or is it impacting you in different ways, it is better to see the doctor first, diagnose the condition appropriately, and then go for the physiotherapy or any other alternative therapy that you would like to pursue.
Okay.
But the role of physiotherapist is as good as the role of any doctor is in getting the patient back to recovery.
Right.
So because they spend almost 40 minutes to 1 hour with the patient while doing the therapy. So they're able to make out much more findings which change on a daily basis sometimes in some patients, to focus their attention on putting them back to what. And there are thousands of questions the patient would like to ask.
Absolutely.
Smaller questions like, okay, I want to do this. Am I allowed to? Can I do this exercise? What happens if I do this? I bend forward and, this is my job. I need to do this every day. So how much can I do? So those physical questions are more easily answered by the physiotherapist who are anyway spending, a 40-minute, 1 hour time with the patient while doing the therapy.
Right.
And their examination is much more detailed when it comes to musculoskeletal examination in terms of which muscle might be more tighter than the other muscle. How's your balancing? Those kind of things.
Right.
They have a very important role, but the regulation requires the patient to first see a doctor. And I would say it is making more sense as well because then you are diagnosed appropriately.
Diagnosis is very important, right?
Also, at some point of time, you might not need to do certain things. You might need to avoid certain things based on your other findings, which the therapist might not be aware.
Absolutely.
Right? So we need to tell them that, look, you need to do this for the patient, but try not to do or get into that kind of activity which might aggravate the other condition the patient might have coexisting.
Right. The pathology, the internal pathology, probably the doctor knows better.
Because you have treated the patient for other things as well. A patient who has a spinal condition now could also have an old hip or a knee condition, which I'm aware of, but I'm telling the patient for the spinal condition. But the therapist may not be aware of what the other things could impact the patient's spinal problem currently. Or the spinal therapy might affect the patient hip or knee pathology.
Right.
So as long as they are aware, we are on the same page, outcomes are really great.
But then first see a doctor.
Preferably.
Absolutely. Yeah. Dr. Marya, how important it is to lose weight in terms of prevent some certain kind of, injuries, or I would say some damage, which can happen due to, heavy weight, and how lifestyle changes can really impact any kind of damage happening to the joints and bones.
For orthopedic conditions, it is one of the commonest advice that we give to the patients when they are having a higher BMI, body mass index, or weight. We tell them to lose it. So let's say a patient who is a 55-year-old female who has a weight of 100 kilos plus, who has knee pain and osteoarthritis on the x-rays. Now, even if the osteoarthritis is, let's say, early stage, what is the advice any doctor would give to such patient would be that, okay, we have to do something for the joint. We'll see that later on. But there's a weight that you're carrying all the time on your joint, which is going to impact the quality of the lubrication of the joint, the quality of the joint space, and the wear out will be much more faster because you are having a higher weight. So losing weight is one of the very important factors in patients who have lower limb conditions at least.
Okay.
Starting from the lumbar spine, disc problems in the lower back, hip issues, knee issues, ankle issues. Any of this will impact, your weight will impact any of these issues. So when you are having a joint problem in your lower limb especially, you must lose weight. And this is applicable even to upper limbs. Patients who are more obese take longer time to settle down with their frozen shoulder, for example, or a cervical spondylitis as well, because they are carrying the burden of weight even in their upper back as well. So we always advise patients to lose weight, and it really works magic for those who really heed to this advice and they do the weight loss.
Right.
The other part of the weight loss is exercising. So you can lose weight either by diet changes or by regular exercise. For us, both are important, but the second part of losing weight alongside with exercising is helpful because you are also strengthening your muscles which are near the joints. So if your muscles are stronger, which are closer to the joints, the muscles take up the load of the weight
Right.
or activity, and the joints are now de-stressed.
Right.
And the joints are de-stressed, they have a longer life, and they are more healthy for longer period of time.
So the weaker the muscle, the more the joint is involved and having pressure.
Absolutely. So which is why people who have even spinal conditions, once they get relief from the primary pain, when they are settled down with their pain, they should regularly exercise. So if you exercise regularly, the chances of your pain coming back are much lesser.
Right.
And the intensity of that pain is also much lesser when you are on a regular exercise.
Right.
But one important part is when you are in pain, you do not exercise. You take rest, medication or whatever is required. There's no point in stressing out, when you are already in pain. It
How
might
can we-
impact to injuries.
I'm sorry. How can we relate this to the pain which is in gym while working out? When to stop? Because sometimes the trainers, they say, okay, the pain is good. It's fine if it's paining. Sometimes during workout also you feel that, okay, this movement is painful for me. Shall we stop? Shall we see a doctor, or we'll just give a rest to it? How we differentiate between that?
Very important question. These days, I see so many patients who got injuries while they were exercising or they were under instruction of a trainer. Nothing against the trainers. They are there to motivate you. They are there to help you reach your goals, whatever goals you have given to them, right? They are doing their jobs, but they can't listen to your body. You can listen to your body. Your body tells you certain things. I have a series of patients I've seen over the last 5 years where they were doing fine and they got free from their routine life, wanted to change their, lifestyle because by exercising or by losing weight, losing some inches. And when they started doing that, when they were above 35 years of age, many of them have got injured while doing these workouts because they were pushed too hard, which is so sad because then they go back 5 steps. First, needing to take care of the condition which they have developed now, and then go back to their levels of fitness they were having even before starting to do those workouts.
Right.
So your question is very important. When do you stop and when do you go on, right? So whenever we start exercising any part of our body, we are basically exercising our muscles, and the muscles impact our joints, which is what they move.
Right.
So when you start doing something new, I always suggest everybody to go really slow. First 6 weeks of your start of any exercise program will define how next 6 months will go. First 6 weeks. You do not exert yourself in the first 6 weeks. First 6 weeks, you just walk, you swim, you do mild cardio, you do mild light weights, because your body needs to get tuned to those changes that happen.
Right.
So if you do a workout on an upper limb today and you do a lot of sets, you might have soreness in that muscle, which is what I think you are asking.
Yes.
And that soreness should ideally settle down within 72 hours.
That's very important. Within
That's
72
very
hours, it
important.
should settle
Any
down.
pain that you develop after doing an exercise, which doesn't settle down within 48 to 72 hours, is something that has been hurt. And then you try to push that hard, you will have a partial injury converted to a bigger or a deeper injury.
Right.
So seek appointment or a help when your pain after an exercise doesn't settle down within 3 days. or if it is associated with some kind of a bruise that you can see on your skin, or some kind of a swelling that has appeared in a joint. A normal activity should not cause a joint to get swollen, right? So if the situation is with the bruise, with the swelling, you should seek help at that time. Stop whatever you're doing. Avoid that particular area to be exercised. Maybe if it is in the upper limb, you can continue to walk. The lower limbs can do some other exercises, but that injured part should be rested out for it to allow it to heal. You are always going to be pushed with your trainer, which is his job or her job, because they want to make sure that you don't lose heart. They encourage you to do things. But when you are listening to your body, the body will tell you what is right for you at that stage. See, a trainer is training a person from the age of, let's say, 14, 15 these days to somebody who is 75, 80 these days. But the body reaction to activity is very different when you are in 20s versus when you are in 50s.
Right.
Your body is adaptable to change. It heals pretty quickly when you are in 20s and 30s. So, but for them, the exercise program remains almost the same. Not the same, but almost the same.
Right.
But if you listen to your body, it tells you that you are in pain or some discomfort, or you are not able to do a certain thing, don't push yourself hard.
Right.
Injuries are very difficult to manage versus just working out.
Yeah, because in gym, I've really seen that people, even if they're in pain, they will push. They'll be like, okay, it's fine. I think because I worked out a lot, my muscle is trying to resist me. They take it as a challenge and they push it more, but it can really,
So in
impact
some
in a
cases,
negative way.
it really brings them back to 5 steps. So now they are stuck with the broken ligament or injured rotator cuff inside the shoulder, which will never heal. There are certain injuries in our body which don't heal. The ligament injuries are notorious for inability to heal. By default, the structures of the ligaments are such that you need to repair them surgically. So when you land up in such a surgery, in such a situation, you are going to land up in a surgery. So where does your workout regime go? It goes for a toss, because you are now fixated with the problem in one of the shoulder. You can't do certain weight above a certain level unless you fix it with the surgery. And then after surgery, you have to go for a rehab. You need 6 months to recover. So you go back few steps, many steps. So it's good to do exercise, but it's not going to. When you are looking at some people who are like professionally looking really good, chiseled out bodies, men, women, bodybuilders and all of that, they might be into a professional league. They are not only doing what you are seeing them doing in the gym, they might be doing many other things with help of some other professionals.
Absolutely.
So you should not see somebody and get inspired, but don't copy them. Don't go for the same exercise program, because they have 10 years of training done prior to what you are seeing now.
True.
Right? So the mantra I could sum up is go slow. So there is no hurry. People who go fast are generally the ones who get injured, and then they are not able to do most of the things that they would have loved to do, and they could have done if they have started slow.
Right. Okay.
Consistency, if I can add, is another thing. There's a term these days we often relate to, is called weekend warriors. So weekend warriors are those people who don't do any exercise for the whole week because they are busy with their work, because they're off their timings and all of that.
I never heard of this term.
Yes, and the weekend warriors will go to fight a war with the sport. On the weekend, there are cricket players or football players or tennis players who would spend 5 hours on just the weekend because they think I can compensate for the 1 hour every day, which I could not do with 5 hours on the weekend. And those patients are generally the ones who land up in injuries because they have overdone a certain thing when their body is not prepared rest of the week. So if you want to really play, especially contact sport or sport like football, where you are not the only player, you have 10 other people, against you, which are going to tackle you and so many things. You should be doing at least some stretches and exercises on a daily basis. If you don't get time to go out to play the sport, but at least you can go to the gym or you can do something at your home itself. So your tendons and muscles should be relaxed, stretched and tensed enough that when you go for a play, you are ready for that.
Right.
The other part I advise people who want to really go for the sport beside the gym is that they should always do the adequate warm-ups. 50 to 90% people who land up in ligament injuries around their knee or the shoulder are those who that day forgot to do the warm-up.
Warm-up is very important.
So my first question in anybody who comes to me first time directly from the field or the day after the injury happened on the field is, did you warm up? Normally I do, but yesterday I forgot to.
So it requires a lot of patience.
And so if you are playing only for half an hour and you have to spend at least 10 minutes in the warm up, you need to add another 10 minutes before you reach and then do the warm up. And then, so I tell the youngsters, even if you're playing for less of that 10 minutes, don't forget to do the warm up first.
They're impatient, or they just want to get into the for me also, like when I go to gym, I was like, finish it off 2-3 minutes on treadmill and then khalas, go hit the gym, that's it. That impatience towards because sports, it becomes a passion for people, right? So
Right,
that
correct.
holding that time where you warm up it's difficult, but it's very important.
Very true. Look, that's why these advices, that's why these podcasts,
Yeah.
you're educating people to understand how they can do right things.
Right
We want
things.
everybody to be healthy, happy, enjoying what they do, enjoying what they want to play. But it should there's a learning for everything, including how you are going to really play. So you learned the way you did exercise in the gym machine, right? You did not know. I mean, everybody starts going to the gym, and then you need somebody, what kind of machine is this? Or you can do this with that machine. There's a learning process. But the first step of the learning process is the appropriate warm-up.
Appropriate warm up, right?
Yeah.
So, Dr. Marya, how a patient suffering from arthritis can, plan whether they should go for a surgery or they should seek, a doctor's opinion to have certain primary treatment to be done, or surgery is the only solution? How should we handle this situation of arthritis, which is very common? It's getting quite common nowadays.
Very true. So as we have an aging population, the number of cases of osteoarthritis, which is the age-related wear and tear, commonly used word,
Right.
is on the rise. No doubt about that. So there's another set of arthritis, which is rheumatoid arthritis, which I don't think we should touch upon for this question basically. So what you're referring to is the age-related osteoarthritis in the joints.
Yes.
So interesting point in this is majority of the patients who are from the Asian subcontinent, India and surrounding countries, they are more commonly having osteoarthritis of their knee joints. Whereas in the West, the more common osteoarthritis in the hip joints.
Oh,
So
is
you
it?
have a waiting list of 5 years for British patients who are waiting to get their hip replacement done in the
Wow,
UK.
5 years.
5 years waiting list after COVID. And many of those patients are now being referred, by the way, from NHS to Indian hospitals nowadays, directly by the NHS to India, because the waiting list in UK is now up to 5 years time
Oh
for
my
hip
goodness.
replacements.
Wow.
Knee replacements are much more common in the subcontinent because we develop more osteoarthritis in our knee joints. Now, does every patient who has arthritis need surgery or end up in surgery? No. It all depends on what is the severity or the grade of osteoarthritis and how is it impacting your lifestyle.
Okay.
So I'll take to the worst case scenario first, wherein why do we need to do a surgery of a knee with a knee replacement? Why we need to do that is because the patient is unable to walk. They need to take a painkiller every day of their life. They are not able to enjoy what they want to do, like example, walking or playing golf or exercising or playing tennis, just going around for a stroll with their dog or with their kids. If it is impacting your lifestyle and if it is a diagnosed case of severe osteoarthritis for which you need to take a medication every day, it is better to do a surgery, replace your knee and be pain-free with a good joint function, which is painless mobility. That is what a knee replacement does to you. It gives you a painless joint mobility. But if you are not in that category yet, you have just started having some symptoms in your knee, you have seen a doctor who has told you that, you have osteoarthritis. There are a lot of things that you can do at that stage to delay the progression or slow down the progression of that disease. Get into a healthy lifestyle. As I said initially, that losing weight, gaining some muscle strength, doing some physiotherapy, eating good, less carbs, higher protein, in the effort to gain more muscle mass as well as improve the weight issues. To add on to that, you can also nowadays take some supplements like collagen, which are really helpful.
Oh, is it really effective? It's quite pricey. So
Yes.
I was in a question mark. Does it really help? Because it's crazy expensive.
Right. So the thing is, there are three types of collagen known to us. There are 5, but commonly used 3 types. Type 1 and type 2 collagen is good for your skin, hair, nail,
Okay.
which is cheaper. Type 2 is the one which is good for the joint cartilages, which is much more expensive, 3 to 5 times the price of a type 1, type 2. So a lot of people who take actually type 2 collagen for the joints also get an additional benefit of having good nail and hair skin growth,
Right.
which many of my patients have given a feedback that after taking this for my joint, actually I started having good nail strength and my face is looking better and all of that.
Right.
But it is useful. In fact, collagen, nowadays I see a lot of younger people who have started to hit the gym have been advised by their trainers to start taking collagen because if you work out strong, you are having a heavy weight on your muscle. The joint is getting affected from that heavy weight. So in order to protect your joint or make sure that your cartilages don't wear out faster, which they will if you're doing really heavy workouts, collagen is helpful. So we give the patients collagen supplements, glucosamine and chondroitin supplements.
Right.
Some patients also require hyaluronic acid injections, which are helpful to immediately give them the cushioning or the lubrication that the joint needs, so that they are able to mobilize it, so that they're able to strengthen their knee, so that they're able to get the benefit of that over the months. By the time their muscle strengthening will happen, at least they'll be pain-free and they'll be having a better mobility.
Absolutely.
So it might be short-term benefit, but it is a benefit.
It's a benefit.
It allows you to become much better for the longer term by giving this injection in the shorter term.
These injections, are they like harmful? Because some people are like scared to get into injections having in their joints.
Right.
Do they have any side effects or any issues post?
Not really. Look, so many women or even some men might be doing fillers in their lips, in their cheeks. People who are into the
that
media,
are superficial.
right? But they are same material, hyaluronic acid.
Okay.
Right? Injecting something into your face, I feel is to me more scarier than putting into the joint. But
yeah,
they might be similar product,
right.
but the quality of product is very different, and there are hardly any side effects of putting a hyaluronic acid inside the joint. It's generally painless in good hands.
Okay.
Most of the patients, when I finish my procedure, ask me, "Have you done the procedure?" So they are surprised that it's been done because they didn't get much pain. There's a way to do that. But overall, even if the handling is not that great, but at least the benefits are generally good.
Okay.
Side effects are really, really rare. And nowadays, in fact, for arthritis, we also have regenerative medicine, biological agents, something like PRPs. There are some agencies where regenerative medicine is picking up a lot in an effort to avoid having surgeries done at any point of time. Right. So a lot of patients are asking for that these days, and we do platelet-rich plasma injections into the joints. Initially, they were designed for younger people who develop a cartilage lesion or a cartilage injury because of an accident or an injury or a sport trauma. Right. We don't want to put corticosteroids in younger joints because in the short term, they may be helpful, but in the long term, they might wear out the cartilages faster.
Right.
So PRP started with younger people, but nowadays I'm seeing people who are in 50s, 60s asking for PRP injections because they feel much better, and the results are very encouraging. I would not say outstanding, but they are encouraging. Okay. But the best part about hyaluronic acid injections or PRP into the joints is side effects are minimal. There's nothing to lose. You might stand to gain 50%. You might stand to gain 100%. Okay. But you don't stand anything to lose. So it's always a good try. Besides, of course, the exercise and the other programs.
Okay. So what are the 3 points you would like to list down as the very important 3 points which if we do, we can prevent arthritis or we can prevent surgery, if we are suffering from arthritis?
So when we are younger, what can we do to avoid leading to arthritis later on in our lives, right?
Right.
So lead a good, healthy lifestyle. So eat good, maintain your lifestyle balance, maintain your weight, exercise regularly to strengthen your muscles. And that you should start when you are in 20s itself.
Okay.
The other thing is eat good. So if you are a heavy drinker, a heavy smoker, and you don't take antioxidants in terms of natural food, fruits, for example, then oxidation is an ongoing process in the body.
Right.
So if you eat healthy food, which is more of a natural food, you tend to lose less of cartilage. The third thing is avoid injuries. So arthritis generally sets up in joints which are injured, with ligament injuries, fractures around the joints, deformities around the joints. So avoid injuries by strengthening your muscles and doing proper warm-ups, stretches, and don't do funny things which can lead to those.
True.
The fourth component is genetic. There's a genetic tendency we will have in the family it will run that you have early set
Yeah.
of osteoarthritis in your joints. You might also have a tendency, but if you know there's a tendency, you should start thinking of that
extra cautious.
extra
You can be
conscious
extra cautious.
beforehand itself. And
Right,
there are
right.
simple ways which I just mentioned.
Right. What about supplements, Dr. Maria? I mean, I've seen people taking supplements unnecessarily, which leads to some of the other problems, which they don't even know about it. So how can we really gauge that, okay, this is good supplement, this will really work on me? Because I have seen people taking calcium supplements, vitamin D supplements blindly, like forever. Does it really help, or does it has any negative impact on the overall health if we overdo or we don't plan it in a right way?
So I'm a kind of person who believes in natural things. I feel personal choices. I'm a doctor. Sometimes I recommend prescription medication and all of that. But I believe whatever body can heal on its own by nature is the best thing to do. All supplements or most of the supplements are chemical in nature to a certain extent. And unless you have specific deficiencies or certain things, don't take supplements.
Right.
Somehow people have come to the thought that, oh, I'm now 40, so I should take some supplements. Why? Your food is enough to give you
This
whatever
is
you
a very
need.
common myth.
Especially
Yes,
calcium.
yes.
People think calcium or vitamin D is deficiency is the root cause of all my problems in my life. It's not the case. There are vitamin D deficient people here, no doubt about that, because they don't expose themselves to sunlight.
Right.
And if you're exposing to sunlight but you're covered, the sunlight is of no use to you because you are exposing just face, which is 1% of your surface area of your body. So calcium is of unnecessary use. In fact, some people who take too much calcium develop kidney stones because calcium is filtered through the
Right,
kidney. So
right.
you should not take calcium because you want to make bones healthy. Bones will become healthy when you take a balanced diet, which includes natural calcium coming from the milk, egg, meat, whatever product.
Right.
But it will mainly go into your bone when you are exercising. When you walk every day. If you don't do any workouts, your bones will generally not absorb as much calcium as they can when you put weight on your bones.
But
So
is it
exercising is more
necessary?
important than the supplements.
Right. But then, is it necessary after menopause, where a female tend to go into osteoporosis even after pregnancy? Shall they start calcium on a regular basis, or they should still check their calcium level before starting the supplements?
So, Dr. Anita, calcium levels in their blood actually don't reflect on what quality of your bone is going to be, which is very interesting. Neither doctors tell this to the patient, nor the patients realize that. Your body will maintain a blood level of calcium at every cost. Because if your blood levels of calcium drop down, your heart cannot function normally. Your muscles cannot function normally.
Right.
So the body has hemostasis mechanism where it maintains the level of calcium in the blood, even if it has to take out your calcium from the bones. Because calcium is important in the blood to survive. So your blood calcium will be rarely low, even if your bones are weak. So bones strength has no reflection on your blood calcium. So it's a waste to do for that reason. Coming to the osteoporosis and postmenopausal women, that's a separate set of issue. Women who are in the phase of menopause will have suddenly a drop of hormones in their body. The estrogens come down. So your body is not assimilating the calcium which is available to you, but it's not going into your bones enough. So osteoporosis becomes a different medical thing completely to deal with because of the fact that your hormonal changes have happened. So we evaluate case to case. Somebody who has reasonable, so it is very important to have a great bone quality when you are in 30s. So it's called peak bone mass. If you have a good peak bone mass when you are young, your chances of osteoporosis when you're older will be lesser.
Right.
Women who do not do anything for their bones when they are younger, in 20s and 30s, will have more problems with osteoporosis later on in their lives.
Right.
And the treatment and management of osteoporosis is very different from just taking calciums. There are the specific set of medication. Once your bone has become hollow, because it's the protein matrix which is less. So even if you take calcium, it's not going to go into your bone to stick to the bone matrix because there's no matrix. So osteoporosis is about the bone matrix, the protein which has become lost. So even if you take 1 kilo of calcium over a period of time, it's just going to get out of your body without sticking to the bone because there's nothing to stick on. So osteoporosis is about that issue.
Right.
So a healthy diet, healthy lifestyle, regular exercise is a very important key even when you have osteoporosis. But the medication of osteoporosis is very different than taking calcium and vitamin D.
Right.
We have a test called the DEXA scan that we do
Right.
to check the real quality of the bone. It's a measure which can tell you how bad the quality is, and then we base our treatment based on that DEXA scan.
So, Dr. Marya, how common is plantar fasciitis, which is the inflammation in the fascia, the layer in the foot or the sole? How can a person differentiate any kind of foot pain from plantar fasciitis? Because now everyone knows plantar fasciitis.
Right.
How to differentiate?
So, Dr. Anita, everybody thinks they know what is plantar fasciitis. People assume that they know the things, but it's very different from what people think it is. So, plantar fasciitis is a common condition,
Right.
which is basically giving you a pain under your heel, especially when you wake up in the morning
Right.
and put first few steps. Or when you have walked a lot, come back home and you're feeling of pain, particularly under the sole of the foot, or after a period of rest, and then you start walking. So first few steps are more painful when you have plantar fasciitis. But every foot pain is not plantar fasciitis.
Right.
I see a lot of patients coming and telling me, doctor, I have a plantar fasciitis, I want you to treat it. And then when I examine them, it's something different. For example, flat-footedness can cause people to have weak muscles of their soles, of their
Right.
feet,
Right.
cause them generalized mild ache in the foot, which is not plantar fasciitis.
Okay.
People who have bunions, toes which are bent in the nature,
Right.
or those who have stress injuries because they overexerted, they walked for 10 kilometers, suddenly went on a hike. They
Right.
actually have a fracture in their foot and they keep assuming it to be a plantar. I have had patients
Okay.
who came to me, I have a plantar fasciitis for the last
was
3
a
weeks.
fracture?
It was
Oh
a
my
fracture.
goodness.
It was a stress fracture.
Uh-huh.
So when you have a heel pain, which typically affects you early in the morning when you wake up from the bed, and first few steps are more painful, but as you walk, it becomes better. This is generally a hallmark sign of plantar fasciitis.
Okay.
Anything else may or may not be plantar fasciitis.
Also, calcaneal spur. Calcaneal
spurs.
spur is also a common cause of pain, right? in
Yes. So
foot.
calcaneal spurs generally cause the plantar fasciitis. There's a common finding between plantar fasciitis and calcaneal spurs.
Okay.
But these are the spurs which are under the heel. There are different kind of problems when the patient has spurs or bone growth behind their heels.
Right.
So they cause a different kind of a pain. It's easy to evaluate. A doctor can quickly diagnose you and rectify the problems.
Okay.
But the important thing is go and see a doctor if your pain is lasting for more than few weeks, and it doesn't happen only when you get up in the morning. It happens
Okay.
while you walk, and the pain is more. It's generally something different.
Okay. Knee surgery is dangerous. Knee replacement surgery. People are really scared of having their knee replaced,
No.
and many patients who are into osteoarthritis who really damage their knee, they have very difficulty, like in their daily activities, but they refrain from going knee replacements. Is it really a risk,
No,
or how
look,
should
it's a
people
major
look
surgery.
at that?
It's a major surgery. There is no medication without risks, or medicine have side effects. There is no surgery without risk. All surgeries have side effects. But knee replacement is a very commonly performed surgery these days. Very minimal side effects. Patient can stand and walk the next day itself
next
after
day
a knee
itself.
replacement.
Wow.
And the quality of life just tremendously changes.
Right.
Those who are suffering from pain in the joints with confirmed diagnosis of osteoarthritis, wear and tear, and as I said, they are going to take a medication throughout their life. It's better to get a knee replacement done
Right.
and be pain-free with a good joint mobility, so that you're able to enjoy your life. What are we living a life for? If your life is in pain and you need a painkiller every day of your life, it's better to fix the thing and get on with your life and enjoy it. It's not a risky surgery.
Not a
It's a very commonly performed surgery. In next 10 years, you will see that joint replacement surgery will become the topmost done surgery throughout the world.
Oh, wow.
Because we are aging population now, right? So a lot of people will require that.
Unless and until we follow what has been instructed by you in the entire podcast today, healthy
that should be
lifestyle,
helpful.
the diet.
Yeah, nature has its own benefits. You can't do better than nature. You can come close to it, but you
Right.
can't do better than the nature. So believe in your own body, what God has given you, and protect it.
Right, right. What are the common misconceptions or myth about orthopedic surgery you come across in your daily life, Dr. Marya?
The most common thing that I see in patient is oh, I have a pain here and I think my vitamin D is low. The commonest thing that we see in outpatient practice is people have started to assume vitamin D deficiency is cause of all their pains in the body, which doesn't happen that way. Vitamin D deficiency is generally silent. When your vitamin D is very low, it might just give you tiredness, fatigue, generalized symptoms, maybe hair loss, maybe feeling weak, but not specific pains. If you have specific pain, I have a pain in my shoulder and I think my vitamin D is low. Or I actually tested my vitamin D and it was low. So you are just correlating a presence of low vitamin D with a joint pain.
Right.
As I said, it doesn't make any sense if that may not be the root cause of that issue. So vitamin D deficiency is the number one myth people have, that deficiencies is causing me the pain. Generally, the pains are for some specific reason. When you consult a doctor, then you realize, oh, my pain was because I started to have a wear out of my cartilage in my knee, which is called the chondromalacia of patella, which is causing me the knee pain. Even if I take a vitamin D, it may not do anything good to that.
Okay.
So that's the commonest myth. The other common myths are negative in nature, that, oh, if I do this surgery, I'll not be able to do things with my routine. If I do a spine surgery, I can become paralyzed. It's not that. You do a spine surgery for a right indication at the right place with the right doctor, and you will see that you started walking the next day without the pain that you are suffering from, like the sciatica, for the last 5-6 months. So those patients who are treated surgically for the right indication do really good. The problem only comes when assumptions of the doctors or the patient confuses them as to what is the appropriate treatment, and then they go for a wrong procedure or a procedure which was not really required.
Right. I feel, if I see as a layman, I feel the most common myth is like, people feel that my body, they take it very sensitively. And if any fixing done, I'll not be able to have my regular normal life. So orthopedic surgeries, people tend to avoid.
Right.
They feel that recovery won't be good. I won't be able to have my, again, the normal life, maybe specifically with replacements.
Right. So that's very interesting. This particular myth is traditional to the subcontinent. Whereas when we have patients who coming from the European side or the Americas, they have exactly the opposite behavior. They come and tell us, doctor, I have
just fix this.
Just fix my problem. I want to live my life normally. A patient has come to me who was a Navy SEAL in some armed forces, and he was educated guy. He told me straightforward that, doctor, I have a issue in my foot and I need to put a cortisone there. I said, do you know what cortisone can do? Yeah, I know about it. I want you to fix it because I need to run a 10K marathon after 3 months or 2 months, right? So those patients who come from the Americas or Europe, they want to fix the problems and move ahead in life. Traditionally, traditionally subcontinent people feel, okay, let nature take its course. We'll see jitni der tak avoid kar sakte hain, avoid karte hain, which is sometimes good. I don't say that's wrong, but you cannot just apply it universally.
Absolutely.
When the time comes, it is important to live a normal lifestyle than to live a life of a disabled or a person who I cannot attend that event because I cannot walk without a painkiller. Right? What's the point? If you can fix it, you better get it fixed. And the results are generally pretty good. And coming back to your first question, why did I join orthopedics, was because these things can make a huge difference to the patient's life the next day of their surgery. And it's still the case. Patients are afraid because sometimes they've heard of wrong things happening, but in the right safe hands and then the right indications, orthopedic surgeries give the best outputs to the patient as compared to other procedures.
Thank you so much for your invaluable insights,
so
Dr.
much.
Marya.
My pleasure.
It was a great pleasure having you today.
Thank you.
And hope to see you soon in your
Sure,
OPD.
sure.
I hope in a healthy way.
I'm sure. Thank you so much for having me here. Actually.
Thank you,
My
Dr.
pleasure.
Kirti. Thank you. Take
Thanks.
care.